Now, each year, the government spends about 500 million rand on communicating various messages and advisories to the public and other stakeholders. The government communication information system is tasked with managing and designing these communication strategies and has been central to key campaigns, including COVID-19. Just how has GCIS fared on this score? We're joined by Tshepo Matsheba, Managing Director of Reputation First. A very good morning to you. Thank you so much for your time. Now, more than ever before, the way and the manner in which government communicates is really, really important. In terms of the significance and effectiveness of the communication, what have you observed?
Thank you so much for the opportunity, Mpho, and good morning to your viewers. I think it's been an interesting environment, at least in the past 8 weeks, within the communication spectrum. I won't necessarily say we are evaluating GCIS over this conversation, because that will be unfair.
Yes.
We need a little bit more time and data for that. But what we know, at least at the level of the public, and what we see in the media, is that there has been often conflicting messages that came from the National Command Council, and some of the messages were leaked in advance in the media, and we know that for a case in point to a point where the Minister Mbalula had to, Transport Minister Mbalula had to open a case against Somizi for the comments that were made during a live broadcast, I think, on Instagram. And that already says to you that there's a disruption to a certain extent of the consistent message that government and the National Command Council is trying to relay through various ministers, and more importantly through government communication and information system. And to a large extent, when you go to environments such as SACoronavirus.co.za and the various platforms that government and the presidency in particular have put in place, I would say that overall there has been to a great extent, a consistent effort to drive messages to the public in particular, to educate the public. It works on a regular basis. There is a WhatsApp group that we've seen, but of course all those efforts are often dented when individuals within the National Command Council, it seems, or let's say within cabinet, when they lose arguments within cabinet, they go to the media and contest ideas there, and that's where the problem begins, because it gives the public at least an impression that there is no congruence on various issues that we are facing with this pandemic.
Now, as you speak about that, how has the COVID-19 brought into sharp focus perhaps the deficiencies within government? I mean, you mentioned 2 examples there, but when it comes to how the departments communicate and tie in together, depending on their similarities, what have we seen that's really been bared out for all of us to see?
Yeah, I mean, so if you're asking, I guess your question is about what are the negative impacts of communication initiatives. So the other day, I think on Saturday, I saw a statement or a comment by Minister Mpho saying, well, you know, whenever people differ, because in that National Command Council, there's obviously different views, and there's always been different views within our cabinet, so we shouldn't be the public shouldn't be fooled or misled into thinking that people are always like anonymous and agreeing all the time. So there's always been different opinions, and arguments, but it is not healthy, I believe, for different messages to come out of the same meetings to the public, and that's where things, I think, are beginning to go pear-shaped. Now, we've seen that the president made a statement very clear about tobacco sales.
Yes.
But what was not pushed forward upfront is that, but this is still part of consultation. We are still on a journey. And when the Minister Dlamini Zuma came out actually with a collective decision, and it may very well be that is a collective decision, but when she came out, the public seemed to get a view that there were dissenting views, that there were different views, that actually So to a point where some people said maybe there's a different view by the president and a different view by some of the ministers. But that is not necessarily the case. So that necessitates having a consistent conversation. Now, granted, I mean, the spokesperson of the presidency came out very clear following that discussion to put the record straight that this actually is a collective decision and not an individual's decision, irrespective of the fact that this is a national president, the president of the country and the chairman of the African Union. So it says that the messaging is very important, but also protocol about messaging matters the most. And I think the Department of Health, through the Minister Zweli Mkhize, has been very clear as well about who communicates on the technical aspects of the virus. I think that component of the work has been effective, at least in my eyes, up to this point. And I think that government also made important efforts to communicate in different languages on different platforms. But you know, when it comes to communication, one can never do enough. And that's why you only have one chance to get it right the first time.
You say one can never do enough. Of course, that gives the sense that the real communication test essentially lies ahead. And just really tying it in with what Professor Abdul Salim Karim had to say, he said that boots and guns alone are not enough to persuade the public to support government's COVID-19 interventions. When it comes to the messages being conveyed and being heard and implemented, what is the big test that lies ahead?
So the big test, there are a few issues. Firstly, you've got to watch out for, and I always say this, and I say this openly, you've got to watch out for Africa's context. So we are in an environment where there's a lot of myths and about different types of diseases. And very often the religious community has a lot of influence. And quite often that influence may create an impression that certain pastors may be able to cure or pray for the cure of COVID-19. And that may lead people into becoming a little relaxing as we go as we reduce actually the levels of lockdown towards level 3 and hopefully level 2 and 1. And as we go towards that, we need far more discipline in terms of communication. And that means that we can't have different views coming from the same environment, because the kind of people, the public that we are educating differs in terms of the level of education, the level of awareness, the level of access to information. So some people only access information through community radio stations that within which they live. Some people access information online. And then, so as communicators, we've got to be able to position key messages pitch it at the level that every person can understand, irrespective of their educational background, irrespective of their levels of qualifications. And I think that's a very, very, very difficult task. As we reopen schools, it's going to be very important to be able to speak to a 4-year-old, a 5-year-old, a 6-year-old in the same way that we speak to someone who is in their 60s and is a CEO of a business. Messages can lend to everyone. So simplicity of messaging is going to be very important. But the crucial thing is to say the same things consistently and have a very, very clear protocol about who speaks. At the moment, sometimes it seems like there's a plethora of ideas. And I think that there's also a responsibility on the part of analysts, political parties, religious leaders to be cautious about the kind of information that they share with the public, the kind of narratives that they drive with the public, because